Welcome, everyone. I'm Ken Carrar, President and CEO of the Council, and I'd like to welcome you to this afternoon's webinar, one of the many I'm sure you're doing. At some point, if you haven't already, your firm will be reopening, depending on where you are in the country, and you and your colleagues can return to your workplace. Going from weeks of global quarantine to getting back to some semblance of, quote, normal or new normal will probably look very different than what it did 2 months ago. And in order to make this transition, a critical element is making sure that your employees feel you're doing everything possible to make the workplace a safe, physically safe place. It's important to alleviate that fear and angst, and they are bringing with them, when they return, the fear and angst that they're bringing with them as they return, and alleviating that fear and angst is really essential for the emotional well-being as well as just settling in. And public sentiment backs this up. A recent survey from Edelman, a PR company known for producing the annual Edelman Trust Barometer, recently revealed that 78% of the public find that businesses have a responsibility to ensure that their employees are protected from the virus in the workplace. Yet only 42% of them really believe that businesses have fully prepared for the eventual recovery and figured out how to get back to work. Today, Scott Cinder, the Council's Chief Legal Counsel, and his colleagues from Steptoe Johnson will lay out some of the considerations around compliance, risk management, and coverage issues that you need to keep in mind as you make plans to return to work and guide your clients. We are recording today's webinar, and we'll post the recording and the slides in the Council's COVID-19 Resource Center shortly after the webinar. The Council has also created a back-to-work guide of curated information and sources which will be updated regularly. It's a living document, and it's focused on how to effectively make a safe return to work possible. The guide is also posted on the Council's website in the Resource Center. If we could pause a moment, and I would just ask a couple questions. Ask you first to focus in on the Q&A box at the bottom bar, and we'll try to answer as many of those questions as we can. If you have technical issues, please post them in the chat box. The chat box will not be there. We will not review the chat box for questions, only for technical issues. The Q&A box is intended for the questions, and Scott and his team will manage those questions as best they can. So with that, I turn it over to Scott. Welcome, Scott, and thank you again for all your hard work.
Thanks, Ken. Good morning, everybody. Pleasure to be with you again. Kate and I are joined today by two actual experts on labor and employment issues, since we thought you would benefit from their perspectives. Steve Wheelis, who's a partner with us and is the chair of our employment and labor practice group, and Beth Call, who is a partner in that group, a very critical partner. And I've worked very closely with both of them and enjoy working with them a lot. And I think you're gonna appreciate the insights you get from them this morning. Nick, can we go to the next slide, please? So our agenda, I'm gonna actually start with a non-agenda item to just sort of, set the tone right at the beginning. And I think before you decide when to open, who to bring back, how to do it, and some of the other considerations that Steve and Beth will cover, and then Kate and I will sort of close at the end on the insurance issues and some of the customer-facing considerations. You really need to think about whether to open at all in terms of bringing people back to an office or retail environment. And I think that this is going to turn a little bit on the extent to which you can effectively deploy your workforce in a telecommuting environment, as you have been doing for the last, well, we've been doing it in DC for 8 solid weeks now. Because once you start to bring them back, then you're going to have some legal considerations that are going to face you. We're going to close with some of those, including Governor Newsom's executive order in California yesterday that changes the rules of the road for workers' comp in a COVID environment. But we'll end there. So why don't we go to the next slide, Nick, with the map, which shows you on a visual basis kind of where we are today on closed states and states that are in the process of reopening. And let me turn it over to Steve, who's going to take it from here.
Great, thank you, Scott. If we could go to the next slide, Nick. And so these are some of the decisions that you will want to think about as you decide whether to open your business, and also when and how. And I just add these thoughts here for your consideration. There's obviously probably 2 or 3 hours of discussion and brainstorming for each one of these bullets. So just think about these things as you're making the decision. But once you have made the decision that you're going to reopen, you want to think about how to bring back employees to the workplace. Next slide, Nick, please. So I've been practicing in the labor and employment law area for something like 26 years now. And, you know, I thought I had seen it all. But it only really, I guess, takes one global pandemic to realize that life can throw us something new at any time. And I suppose one of the first lessons that I've learned in counseling clients through the early stages of the COVID-19 impact is that many of our one-size-fits-all workforce templates that we're used to using just don't apply in this crazy COVID-19 world. So the first suggestion that I have for you that's suggested by this slide is that we need to think about how to bring back employees to work. And in doing that, we need to probably jettison our expectations that we're going to have just one plan to make that happen. Instead, I think we're going to have a number of alternative scenario plans that can be adapted to a wide range of employee issues. And that may require a bit of a different mindset than what we're used to, which I propose may require a much more collaborative, problem-solving model with constant employee engagement to figure out how to put the puzzle pieces together, as opposed to maybe what we might be used to, and I was certainly used to in my prior military days of a directive command and control model. So really need to probably be thinking about a different mindset and a different model in bringing back employees to work. Next slide, please. So if you envision with me this idea of a collaborative problem-solving model for making back-to-work decisions, what lens do we want to be looking through? What perspective should we adopt? And I'd recommend that we need to put on our world's okayest employee hat and ask ourselves something like, if I was an average employee being told it was time to come back to work, what might my questions or concerns be? And I think if we do that and then think about the proper framework for addressing those questions and concerns, we'll be well down the road towards a successful return to work effort. So what are some of the likely questions and concerns we're going to get from the world's okayest employee? Nick, next slide, please. So I've provided a list here of several probably typical questions and concerns from employees that we can think about together over the next few minutes. But before we dive into them, let me make two important points. The first one is there are probably at least a dozen other back-to-work questions employees are going to ask you. But we only have a short time together today, so I picked what I thought might be some of the most common types of questions. And I hope that in addressing these questions, we'll see a pattern of how to triage these issues that you can apply to other types of questions. And obviously, you want to consult with counsel on any sticky wickets that have you scratching your head on what to do. And speaking of counsel, as a second important threshold point, let me be sure that we all understand that we're not providing legal advice today. Happy to do that offline if desired, but in this presentation, we're just providing some general education suggestions and best practices to think about. So let's look at some of these expected scenarios. Let's start with scenario one in the upper left-hand corner. We've got an employee that identifies as being in a high-risk group, but is just eager to come back and can't wait to be back in the office. What do we do with that employee? Let's make it even a little bit harder. And let's say that we know that this gung-ho employee has a compromised immune system or a serious kidney problem. And we know that getting infected with COVID-19 might create a serious risk to their health or life, or we believe that to be true. So what do we do? This may be a very tough ethical dilemma, but generally you cannot discriminate against someone because they have a disability. Or if they're at risk because of their age, say they're 65, 68, 72, we cannot discriminate against them based upon their senior status. So the best practice here, which is not a one-size-fits-all approach, would be to have the appropriate HR or senior ops person, somebody you really trust with delicate conversations, engage the employee in a dialogue. Talk about your work expectations. Ask them if they're ready to jump back in, and generally give them an opportunity to share any medical or health concerns with you. And then you want to be sure you document that conversation, keep it in a separate confidential medical file for that employee. And if they don't bring up their medical condition or their at-risk status, and if they don't ask for relief from returning to work, but instead want to return to work as soon as possible, then you should not prohibit them from doing so. This is a delicate point, and it's so delicate that the EEOC, that's responsible for regulating a lot of these disability issues in the COVID-19 context, issued guidance on this point day before yesterday, and then yesterday pulled it down because they sort of got it wrong, and they have put it back up today with the guidance I just shared with you. You can't, as a general proposition, discriminate against someone because of their age or their underlying health status because you think they're going to be adversely impacted by a possibility of exposure to COVID-19 in the workplace. There is an escape hatch, though. If you, after consultation with your medical advisors, are convinced this person is going to be at a direct threat to their own health by coming back, you can engage in the direct threat analysis with your legal and medical counsel. If you determine that coming back would create a direct threat, you can engage in a reasonable accommodation process with them to determine if there is an at-work accommodation that can relieve the direct threat. And if not, you can continue the conversation with whether or not there's a accommodation away from work, such as teleworking or some kind of leave that would alleviate the direct threat. And of course, in all of that, you have to consider whether any type of accommodation would be an undue burden to your operation. And only after you do all of that, and only after you're very confident that you could prove this person was a direct threat to themselves by coming back to work, only then could you prohibit them from coming back. That's a very high bar to meet, so you'd want to be very careful as you think through those subjects. The likely scenario is you got somebody that you think might be at risk, but they're ready to come back, and after a dialogue, they're confident they want to come back. You can't prohibit them from doing so without discriminating against them. So let's look at the flip side of that quickly, and that's the seventh bullet, the bottom one on the right. This is the flip side. You got somebody that's at risk but doesn't want to come back to work. What do you do with that person? Well, in this reverse situation, the first thing you want to do is determine what at risk means. If it just means that they're over the age of 65 but otherwise healthy, they don't have a basis to refuse to come back to work or to request an accommodation such as teleworking. But if at risk means that they have an impairment, a physical or mental impairment that substantially limits a major life activity, then the appropriate management representative will again want to engage in an interactive process with the person to determine if the person can perform the essential functions of his or her job with some type of accommodation. And you can ask for medical documentation to support and inform the discussion. And remember, an accommodation won't exist doesn't have to be the one the employee requests as long as it is reasonable. Then as an alternative, as a result of this dialogue, you determine that an accommodation is not required. You can always consider allowing the person to use accrued regular vacation or sick or unpaid leaves. But remember Steve's employment law rule number 1, which is no good deed goes unpunished. And the corollary to that rule is, what you do for one, you must do for all. And that's especially important in this COVID-19 world, because on top of COVID-19 issues, we've got Title VII and EEO issues that prevent discrimination on a host of Title VII characteristics. And remember, document your conversations with employees. So let's look at the scenario number 2 there, second bullet on the left of your slide. Can you require this employee to return to work or face discipline, young and healthy, but worried about getting COVID-19 and taking it home to someone at risk? The answer is yes, you can require them to return to work or face discipline. Again, you'll want to have a dialogue with the person to explain all the things that you're doing, which Beth will cover in a moment, to create and maintain a safe workplace free of recognized hazards. And as part of that dialogue, you'll want to assure the employee that you as the employer are taking all steps required by OSHA to ensure a safe workplace, which precludes the employer from later claiming they did not return based upon a reasonable fear of death or serious health risk. And you'll want to explore their concerns, including exploring whether grandma is sick with COVID-19 and or whether the employee is caring for grandma if she has a serious health condition, which might entitle the employee to regular FMLA leave. But if the desire not to return to work is just based on a general anxiety about being exposed or exposing a family member, then that general anxiety does not impose any obligation to provide an accommodation, nor does it grant any particular leave rights. So let's look at the next scenario, bottom left on your screen. This scenario really turns on whether you're an employer with fewer than 500 employees, and thus covered by the Families First Coronavirus Relief and CARES Act. It also can turn on whether or not your local jurisdiction has imposed certain types of corona or COVID-19 related leaves. And recognize there are at least 15 states that have done so, and a number of cities like Philadelphia, Seattle, Los Angeles, San Francisco, San Jose that have imposed leave requirements in COVID-19 context on all employers, just not those under 500. So if a person is, if you're an employer under the Families First Act, you're likely going to have this employee is going to be eligible for up to 12 weeks of paid leave at 2/3 regular pay, up to a capped amount to stay at home with a child or children. But again, you want to engage in a dialogue with the employee. Is telework an option? If so, can they telework? If their physical presence is required, can they come to work on certain days or on a modified or shifted schedule when they might otherwise have child care coverage from another source? If so, you can require them to work when not needed for child care. But if not, you must allow for emergency paid sick leave or the extended FMLA required by federal law for employers under 500 employees, or state or local leave laws that may apply. And again, if none of these additional leave laws apply to you, you may still want to consider the value of this employee and your existing paid and unpaid leave policies to determine whether you want to figure out a mutually acceptable solution to the employee. So now let's move over to the top of the right-hand column. And this scenario is really a variant of scenario number 2. I'm doing fine, but I expect you to convince me that it's okay to come back to work. You'll want to explain all the things you're doing, again, to comply with the applicable OSHA requirements, to convince to at least articulate to the person that you're creating and maintaining a safe workplace free of recognized hazards. And you'll want to explore their concerns, again, to determine if there's some specific issue you can help them understand, or if they have an idea maybe you haven't thought of that you could implement to address their concern. But at the end of the day, you can require them to return to work or face discipline. Finally, let's look at the scenarios 5 and 6 there, second and third bullets on the right side of the screen. In this circumstance, in scenario number 5, you're entitled, due to the direct threat of COVID-19, to ask questions like, are you still experiencing symptoms? Have you recovered? Are you non-contagious as certified by a medical professional? And if the person is still experiencing symptoms, you should tell the employee to stay home in quarantine until cleared by a medical professional with documentation to that effect. At that time, the employee should contact you about returning to work. If the person is symptom-free, you can ask for medical clearance, or if that's not practical due to wait times at the doctor's office, you can ask for a self-certification with the appropriate questions you can get from a medical advisor. And then finally, looking at the scenario number 6, third bullet on the right side, given the COVID-19 threat, you can ask this employee to describe their symptoms. If their symptoms don't track COVID-19, stop and deal with them like any other sick employee under regular circumstances. If they describe COVID-19 symptoms, then you'll want to follow the steps we just discussed for the last scenario. So next slide, please. So that's a whirlwind tour of a few scenarios you may face as you think about how to bring employees back to work. Lots of legal landmines out there to consider. Hopefully, in the few moments we've had, we've helped you with some issue spotting ideas today. And if you have other questions, we'll have some time at the end to address those. So let me turn it over to Beth now and ask for the next slide.
Can you hear me?
Yes.
Okay, great. It looked like I was muted. Good morning, everyone. And thank you for joining us this morning. So Steve kicked us off, Scott and Steve kicked us off with some general considerations about bringing your employees back to work, and then some practical considerations on an employee basis. What I'd like to spend the next several minutes on covering with you all is things to think about in your preparedness plan. As you think about going back to work, some practical considerations for practices to create and maintain a workplace that is safe for your employees and customers as you reopen your doors. And there's several components of that, and I list them on this slide, and I want to cover each of them, although probably not in the detail that you're going to want to address them as you think about reopening your doors, but we'll hit the highlights this morning. The first is medical testing and inquiries. Can you do it? What can you ask? How do you go about doing that? The second, Steve touched upon this, and I'll touch upon it again very briefly, our employers' obligations to accommodate employees, and particularly high-risk employees. Also, I want to spend some time discussing federal and state law mandated safety requirements, things to think about in terms of what you have to do to prepare your workplace and maintain your workplace in a safe way for your employees. And finally, I'd like to conclude with communications that are highly recommended with employees, because right now, communication is key. Next slide, please, Nick. In terms of medical testing, there's been a lot of chatter about what you can do, and you've probably heard on the news, and you've heard other employers, especially employers in essential business areas, doing some of these things. So I think it's important to understand what you can do, what you cannot do, or whether it's unclear whether you can do certain things. So one very common practice that's been implemented among businesses that have essential workers back to work, right? Essential businesses have been temperature screens. And this is something that the EEOC has guided is okay to do right now, because the COVID-19 virus has been declared a pandemic by the CDC. So employers may measure an employee's body temperature to determine whether they have a fever. And that's consistent with the EEOC guidance. In terms of what is a fever, the CDC defines a fever as 100.4. So you're really going to be wanting to look at that, temperature range when you're considering monitoring employees' temperatures. Also, there's been a lot of discussion about whether an employer can require employees to take COVID-19 tests. So the answer is yes. And during the pandemic, employers may use accurate and reliable COVID-19 to test employees before they enter the workplace to determine if they have a virus. However, if an employee refuses to take the test, you cannot force them to take the test, but you can refuse entry to the workplace, right? So that's a very important distinction. You can never force an employee to take a test, but you can refuse entry into your workplace. And if they refuse to take a test because of some type of objection that would be covered, under an applicable law like the Americans with Disabilities Act or Title VII as a protected disability, or we're seeking an accommodation or a religious accommodation, I strongly encourage you, and you would want to engage with counsel to understand how to handle that dialogue with the employee. In terms of antibody tests, there's been a lot of discussion about them. There are several out there currently. It is unclear, at least from the EEOC standpoint, whether those are permissible under the applicable federal law. So right now we have no guidance available on whether employers may ask their employees to take antibody tests. Next slide, please, Nick. So, as I mentioned, there's a couple things to be thinking about in terms of medical inquiries and medical testing. So employers may require temperature or COVID-19 testing of employees prior to entering the workplace. In addition, employers may ask employees if they're experiencing COVID-19 symptoms, consistent with the EEOC, consistent with CDC guidance. So, as all of you may be aware, the CDC has recently updated their list of COVID-19 symptoms to go beyond what we had initially had, right? Shortness of breath, coughing. It now includes sore throat and chills and some other symptoms. Loss of smell, loss of taste. It's okay to ask all of these questions of employees, and employers who have been operating through the COVID-19 crisis in the areas of essential business have been doing this and have been doing this in a very effective way in terms of providing guidance to employees about expectations about, not to enter the workplace if they're experiencing any symptoms, expectations around self-monitoring, and addressing these situations as they come up in the workplace if an employee approaches you during the workday and indicates that he or she is experiencing one or more of these symptoms. So that brings me to my third point. If you are in the midst of your workday and an employee approaches you and indicates that he or she has a fever or other COVID-19 symptoms, it is absolutely permissible to send that employee home. Sometimes it's not feasible to have the employee immediately leave the workplace. Perhaps the employee is not feeling well enough to get home on their own. Perhaps the employee relies on some type of public transportation, which is quite often the situation with many workplaces located in cities. In those instances, you would want to put the employee in an isolated space in your workplace away from other employees to limit exposure to any potential virus or medical condition that he or she may have, given that he or she's indicated symptoms, and then make arrangements for getting the employee home. Also, if an employee indicates that they have a positive COVID-19 test, likely this won't happen during the workday. Most likely you would get a phone call. There are some steps you're going to want to take in terms of making sure that you maintain a workplace, which I'll address in the upcoming slides, but most certainly you can tell that employee not to come into work. And you also can ask that employee to self-quarantine for the recommended amount of time by the CDC, which currently is 14 days. Next slide, please, Nick. Few things to think about in terms of medical testing and inquiries, in terms of do's and don'ts. So you do not want to discuss a specific employee's results, be it temperature check results or COVID-19 results test results in the presence of other employees. Test results may be recorded and maintained by you as an employer, but they must be maintained confidentially in a separate record, the same way you keep any other medical records of your employees. Also, it's going to be very important in terms of meeting safety expectations by government agencies and state and local requirements, federal, state, and local requirements, but also for the comfort of your employees in the workplace and maintaining morale, that you continue to have communication with your employees about safety protocol in the workplace, including advising them of potential exposure. So it's very, very important if you find out that an employee has tested positive for COVID-19, that you let the employees who may have been in contact with that employee during the workday, that they may have been exposed. However, you do not want to identify the name of the employee infected. Now, I understand that those of you with smaller workplaces may see this as a not very practical suggestion. If you have 10, 12, 15 employees in your workplace, it is, highly likely that folks are going to have discussion and try and narrow down, if not quickly determine which employee had the positive test, since that employee would not be in the workplace at that time. The key thing here for you as the employer is to follow the EEOC guidance, which is for you as the employer to maintain confidentiality around the information. If other employees discuss it, that's something that you can address in terms of respectfulness towards other employees, right? But as the employer, it's very important that you do not disclose this information to employees. Also, you're going to want to consider data privacy requirements, which could be the subject of a whole nother webinar. So I'm going to touch upon it very high level. But two things to think about here is HIPAA, right? As well as any data privacy laws in your particular state in which you have operations. So HIPAA, first of all, the key thing to remember there is HIPAA applies to medical providers, not employers generally, right? So if you send your employees out for COVID-19 testing and you have it arranged with the lab that you're going to be paying for it, and you want the results to come directly to you as opposed to coming through the employee, then the employee would have to sign a disclosure for their personal health information to be disclosed to you. That would be the HIPAA play involvement in this scenario. And then the California Consumer Privacy Act, which went into effect earlier this year, that has certain obligations that include a disclosure obligation to employers around any type of medical testing. So something to think about there. Next slide, please, Nick. Okay, this is a meaty slide. I'm not going to spend a lot of time on it. Steve talked earlier about accommodations, but I do want to highlight that requests for accommodations may not just come up before an employee is asked to come back to work. They also may come up once an employee is back at work. And I've seen this quite a bit with my clients who are operating as essential businesses currently with their essential workers, that, recognizing that we're all dealing with a very fluid situation, and the nature of the workplace changes very quickly in terms of PPE requirements and other types of social distancing requirements, and fears, different folks identified as high risk. The CDC list has expanded, and as that happens, you may find employees coming to you with requests for accommodation who did not initially come to you. So a couple of quick highlights here. Who is entitled to an accommodation? What we're hearing from the EEOC is to consider older adults and people of any age who have serious underlying medical condition. Okay, so this is what we're hearing from the EEOC. Who likely would not be entitled to an accommodation? An employee who does not want to wear a PPE mask because they don't like it, or they're not comfortable with it, or they don't think they need it, right? So distinguishing between folks who may come to you and say, I have trouble wearing a mask because I have contact dermatitis and the mask you're providing to me is causing me to have a reaction, versus people who say, I just don't think I need a mask, right? That those folks would not be entitled to an accommodation. Also, as Steve mentioned earlier, if there's not a serious underlying medical condition and the employee is just fearful of exposure, that employee would not be entitled to accommodation, at least under the Americans with Disabilities Act. And then, of course, you're going to want to consider what types of accommodations may be considered reasonable. We have some guidance from the EEOC there, considering different types of PPE for employees, reduced contact with other employees, one-way aisles, plexiglass tables, or other barriers to ensure minimum distances between customers and coworkers. Telecommuting is obviously a recognized accommodation, as well as unpaid leave. So just some things to think about there. Again, I encourage you, because this is such a fluid situation, and this is not just a novel virus, but this is a novel legal environment that we're working within. I encourage you to work closely with counsel as these issues come up. Next slide, please, Nick. Okay, in terms of safety requirements for the workplace, there's going to be 3 sources of information that you're going to want to look to and think about, the guidelines, as well as ensuring compliance with each of the sets of guidelines. And the 3 sources are going to be OSHA, the federal OSHA, as well as the state OSHA agencies, the CDC, and of course the state shelter-in-place and stay-at-home orders, which many of them, if not all of them, and I haven't looked at all 50, I will acknowledge, but the ones I have been deeply involved with have had significant social distancing requirements embedded in them that apply to the workplace. Next slide. Thank you, Nick. Safety requirements for the workplace, according to OSHA, include quite a few different components. I'm not going to go through each one of them in detail, but they include physical distancing measures, basic infection prevention measures, right? Some of these things include not just promoting cleanliness in the workplace, but providing the tools so employees can easily do that, right? So I have clients who are considering providing not just hand sanitizer and different things available to employees, but providing kits to all employees coming back in the workplace that includes hand sanitizer, masks, reusable masks, right? Multiple reusable masks, tissues, and different things that they can have at their arm's length to make sure that they're staying safe and they're keeping their workplace safe and sanitized. Also, it's going to be very important to develop policies and procedures for promptly identifying and isolating sick folks. This is what I mentioned earlier. Workplace controls are going to be really important in terms of air filters, physical barriers, sneeze guards, those type of things, as well as social distancing. They're suggested in combination, not in the alternative. Administrative controls, such as minimizing employee contact, staggering shifts, is a very common option being considered right now, because that minimizes the amount of employees in the workplace, allows for restructuring the workplace to provide for better social distancing and minimizes contact during the workday, because there's less people in the office. So to the extent that's a feasible solution for your workplace, that's something to consider. And then, of course, personal protective equipment, gloves, goggles, face shields, face masks. We don't need N95 masks necessarily to go into a normal business workplace, but face masks are recommended at this point by the CDC and OSHA. And something to consider with respect to OSHA, 2 actually key points I want to make with respect to OSHA is, number 1, OSHA is getting a huge amount of pressure right now from employee advocacy groups as well as unions, that they're not doing enough to be monitoring how employers are keeping their workplaces safe, or whether employers are keeping their workplaces safe. And the meatpacking industry particularly has been under scrutiny, for example, by these groups, as well as, captured the have captured the attention of OSHA. So something to think about is that this is on OSHA's radar, and if you're a small employer, certainly you're not going to be as much of a target as a larger employer like a meat processing plant or a processing plant or a large factory. But OSHA has committed to really focus on ensuring that employees have a safe workplace to be working within. Another thing to be thinking about is that OSHA has reiterated their prohibition against retaliation under the Act, and made it very, very clear that reporting unsafe and unhealthy working conditions is protected activities. So to the extent you have employees who raise concerns about your protocol and what you're doing to keep your workplace safe, you want to handle that just like you would handle any other complaint of retaliation. You want to take it seriously, you want to investigate, you want to document your investigation findings, and you want to circle back with the employee and let them know what you determined, and so that you close out the investigation, you have a record that you did the investigation. It is just as serious a concern as any other type of discrimination, harassment, or retaliation concern that you may get in your workplace. Next slide, please, Nick. The CDC guidance, and it is in fact guidance, is very similar to what we have heard from OSHA. In fact, OSHA and the CDC are very much in unison. But the guidance is here, as you see on the slide, to make sure that you're properly cleaning your workplace surfaces, right, to prevent the spread of virus. So something to put into your preparedness plan in terms of how you plan to maintain cleanliness in your workplace, as well as just safety protocol. That you document and you communicate to your employees, and I'll talk about communication in a few minutes. CDC also encourages practicing social distancing, wearing facial coverings, and preparing proper or following proper prevention hygiene, similar to what we saw from the OSHA agency. Next slide, please, Nick. As I mentioned earlier, the state orders that came out in the March timeframe, for the most part, some of them early April, contained many requirements for employers in terms of maintaining a safe workplace. Of course, they vary from state to state, so it's going to be very important to check your state's requirements. For those of you who have operations in multiple states, you'll want to check the requirements in every state in which you have operations. Sometimes the information is provided as guidance. Sometimes the information is provided, sometimes it's provided as requirements. So you're going to want to understand that distinction as well. The type of guidance or requirements that we are seeing in these various orders include social distancing requirements around staggering shifts, altering workspace to provide 6 feet between employees. We're also seeing requirements around PPE. And I list some of the states that require wearing of masks in the slide: Connecticut, Hawaii, Maryland, and so forth. Limiting exposure through customer contact for those of you that have customer-facing businesses, including contactless payment systems. These types of requirements are incorporated in these state orders. Cleaning the workplace, similar to what we've seen from OSHA as well as the CDC, and some state orders, including the county, a couple of the county orders in California, require the posting of social distancing protocols. So it's not sufficient to just have it, created in your records, or just to share it with your employees. There's a posting obligation. For example, in the Santa Clara County shelter-in-place order. Next slide, please, Nick. So I want to conclude with stressing the importance of employee communications. A big part of this in terms of successfully bringing folks back to work is going to be having your employees feel safe and feel comfortable. And communication is going to be a big part of that. And the communication is ongoing, as Steve indicated. So it starts by letting your employees know about the safety protocols that you're going to be implementing and that you continue to implement, both verbally, and I encourage you to do it in writing, either through internet or other postings. So your employees are well aware of all the actions you're taking to make sure that the workplace is safe for them. In addition, you're going to want to advise your employees of instances of potential exposure, which I touched upon earlier, and you're going to want to timely respond to employee questions and concerns. And this includes concerns that an employee heard that an employee went out of state over the weekend. And again, the state happened to be, a state that has a higher instance of COVID-19. And they have a concern that they may have been exposed and they brought that back in the workplace. It's as subtle as that, because having a conversation with employees about these things go a long way to easing their psychological well-being, maintaining employee morale, and at the end of the day, happier employees are less likely to raise legal concerns. Next slide, please, Nick. Now I'm going to hand this over to Kate Jensen, who is going to speak to the retail customer-facing considerations. Thanks, Kate.
Great, thanks, Beth. So we're not going to spend a lot of time on this slide today because it likely is not super impactful on most council members' businesses. But to the extent y'all are working with clients who are customer-facing businesses, retail, restaurant, these types of things, they're going to be grappling with this entirely other set of issues, and we've listed some examples here. So in addition to the things that Beth discussed in terms of keeping your own employees safe, a lot of that's also going to apply to your visitors, clients, and customers. There are going to be a lot of legal considerations related to ways you're going to attract your customer base back to your business, how you're going to deal with them in terms of subscriptions and promises to ship them things quickly, gift cards, things like that. So this is sort of a food for thought slide for now, and Steptoe has additional resources on all these issues if that's of interest, but wanted to just flag this for your consideration. Nick, I think we can go on to the next slide.
Why don't I pick up we're going to quickly cover the insurance issues, and then we're going to take a little time for some Q&A. We've got some questions in the queue. The main thing I want to highlight here is the workers' comp EO that was issued in California yesterday. It basically purports to create a presumption that anybody who you ask to come to work, who comes to work, if they later contract COVID-19, then they will be presumed to have gotten that at work. It's a rebuttable presumption, but I have no idea how you rebut that presumption. The APCI is estimating that if this were the rule everywhere, it would add $40 billion in potential workers' comp liability on the insurer side. That does not take into account your self-insured clients. And so one thing to flag for them, particularly if they're in California, is that they may have this issue. For employees who are allowed to work from home and choose to come into work, the order does not apply. The other thing to flag is that many general commercial liability policies have virus exclusions. They are sometimes embedded in the pollution clauses or elsewhere. And it's just something to be in mind and to look at carefully if your clients are asking you about the coverage there. I think the EPLI and D&O liability, we're in a new country, we're in a new environment, and we're going to have to see how that plays through. With that, Nick, why don't we go to the next slide? And we have some questions in the queue, and Kate and I are going to go back and forth grilling Beth and Steve, and Kate is first up.
Yeah, we have the easy job today. So I will start with Beth. We have a couple of related questions. So this is a two-parter for you. The first part being, who should you assign to administer your COVID-19 testing, such as taking temperatures and doing, administering screening questions. And if you assign that to employees, so you have employees screening other employees, what types of confidentiality measures might you want to put in place there?
Okay, that's a great question. So let me start with the who. Everyone, even though the EEOC has suggested that a medical professional could be taking temperatures, all of us recognize that it's not practical to have a medical professional at our workplace every day. So a couple things to think about. First of all, the guidance around temperature checks is that if you are to do them, you want to do them before your employees enter the building. Otherwise, it defeats the purpose because they've entered the building potentially with a temperature. Also, I might add that the EEOC, as well as other state agencies, continue to recognize that a high temperature is not necessarily the only indication as to whether someone has the virus. Most certainly, folks can be asymptomatic or they could be pre-symptomatic. So I think that's important to keep in mind too. But in terms of kind of who and how, what I've been discussing with my clients and what I've seen other folks do is to obviously use an employee, but to ask an employee with HR expertise, preferably, to be on the forefront of this, because the level of understanding of kind of the legal requirements as well as the sensitivity and communications with employees really, really helps in this type of circumstance. So for example, if you ask your HR administrator, your HR professional to be the one doing temperature checks at the beginning of the day, a couple of considerations from a practical standpoint. You certainly wouldn't want that poor employee to be out there for an hour and a half stretch, to the extent folks have staggered start times. So you may want to consider asking your employees to come at certain times, but allow for social distancing while they're waiting to have their temperature checked. You're also going to want to instruct the employee taking the temperatures to maintain confidentiality around the results. One way to do this is not to verbalize the results. So if you use one of the thermometers that scan the forehead, I think you all are familiar with what, I think I even had a picture of it on my slide. What I'm talking about, you can share the reading on the thermometer with the employee, and with the understanding ahead of time that if employees have 104 or higher, that they're to step aside and to get further instruction of what to do next, right? And then have someone available to have a dialogue with that employee in terms of next steps. You're also going to want to provide appropriate PPE to your employees who are doing the temperature checks, because they may have potential exposure. Right? So that includes a mask, that includes gloves. It also includes changing PPE after someone has a temperature that reads higher than, the 100.4. So I think that answers the question. Did I miss anything, Kate?
This is Scott. I think that was very comprehensive. Let's flip one to Steve. Steve, what if somebody with known mental health issues expresses a general anxiety about returning to work at the moment?
If the known mental health issue rises to the level of a mental impairment that substantially interferes with a major life activity, then they have a disability or likely to have a disability. And in that context, you would have a legal obligation to engage in the reasonable accommodation interactive process to determine if you can find an accommodation that will work for both parties. On the other hand, if the person is a worrywart and just a nervous person, but their mental health issue doesn't rise to the level of an impairment of a major life activity, then you'd want to dialogue with them. You'd want to give them assurances. You'd want to walk them through all the safety processes that are in place. You'd want to invite their input on what you might be able to do to meet their concerns. And many times they're little things that you could could do by way of addressing their concerns so that you don't lose a valuable employee. But at the end of the day, if they don't have a disability as defined by law, you can require them to work as directed.
Kate, do you want to ask a question?
Yep. Okay, so I think I have another one for Steve. This relates to what you can ask folks as they're coming back into work, but this is a workers' comp question. So as you're bringing people back, are you allowed to ask folks if they sustained any injuries while they were away from work? And does it matter if the employee was furloughed or laid off when they were away in terms of your answer?
The answer is regardless of whether they were furloughed or laid off, we should not be asking generalized, have you sustained any injury or illness questions. Those are medical inquiries, and without some empirical basis to base the question on, it'd be a violation of both likely the ADA medical inquiry prohibition and workers' comp discrimination provisions to ask those kinds of generalized questions on the way back in.
Thanks, Steve. I have a question for Beth from one of our more critical thinkers, and so I think it's an important question to ask. Many states have issued orders and guidance on return to work requirements. Some states require that employers train and educate their employees. Some businesses, including many of our members, have a high number of employees in some of these states, and so it might become administratively burdensome for the company to do this on an in-person basis. Could an email to the employees summarizing the training with a link suffice? Would there have to be a certification by the employee that they have read and understand whatever is provided be required?
So that's a great question. And honestly, without reading each one of the state order requirements, I can't answer specific to the state requirements. However, in an alternative, we all have become very accustomed to virtual communications, virtual meetings. So virtual certainly can be in lieu of in person. And certainly to the extent that there is, and states are recognizing this, right, as well as the federal government, recognizing the limitations on in-person contact and and limitations of the ability to meet with people in person, given social distancing requirements. You certainly don't want to bring people back and have 20 people in a room. So I would imagine that there's going to be some wiggle room, but I would encourage you to look at your specific requirements in your state to make sure that you're compliant. I'm sorry I can't answer more specificity. I think it's important to look at the specific requirements in the order.
Yeah, I would just add, my view would be that unless the order has a specific requirement, if it's silent in terms of how you provide it, then the electronic provision of the training should suffice.
And I agree.
Yeah.
Oh, sorry, Pat. And I would agree that acknowledgement is going to be key, right? Whether you provide the training in person, virtually, or you provide something to them in writing, you will want acknowledgement that it was delivered to them and they understand it.
Good. Kate?
Yeah, so I have one for Steve. I think this really goes to sort of equal treatment of your employees. Can you only force, quote unquote, force someone to come back to work who doesn't want to come back if you do that for all employees?
Well, the answer to that is no. The lawyer answer is it depends. And the practical answer is, do you have a legitimate business justification? So for example, you can force some people to come back and not others if you have a legitimate non-discriminatory reason for doing so. For example, as you reopen, you may want your facilities maintenance staff to come back 3 days earlier before everybody else to sanitize the facility. And so you could absolutely, based on that legitimate business justification, bring back certain employees, certain job classifications, or even certain employees within the same job classifications. But it has to be for a legitimate business reason. If it feels arbitrary and capricious, and that we're, favoring one person over another, then Steve's employment law rule number 1, no good deed goes unpunished, comes into effect, and we have EEO claims and other kinds of discrimination claims. So think hard about the business justification for disparate treatment, and if you pass the smell test, you can do it.
So we have 11 open questions and we have 15 minutes. So I think we're going to fire through these for people who are willing to hang in there with us so we can get to all the questions that have been asked in the hour. Beth, for employees that we're going to subject to the COVID testing in the workplace, the temperature taking and the like, how often can you do it? Can you only do it once? Can you do it every day? Is there a rule?
There's no rule around frequency, right? So, and honestly, if you're using it as a mechanism of ensuring that you have, ensuring that folks don't enter the workplace who have a temperature, then it would make sense to do it every single day. So in practice, practically it makes sense to do it every day before employees enter the workplace. But from a legal perspective, there's no limitation around frequency.
Okay, I'm actually not sure. Steve, Beth, I'll leave this up to you guys who wants to answer this one. But how can you, should you distinguish between employees that have serious underlying health conditions, maybe in a high-risk group, versus members of their household that may be in a high-risk group in terms of, making some of these decisions about how to bring people back, if to bring people back?
I'll jump on this one. The distinction is fine, but there's another acronym that we have to start thinking about: the Genetic Information Non-Discrimination Act, which prohibits us to ask medical questions about family members' medical status. So if in one of my examples, we talked about a healthy person who doesn't want to come back because they have an at-risk person at home that they're worried about infecting. And we walked through the scenario there. The one we didn't touch on is, what if the employee tells us, my grandmother or aunt or grandfather lives with us, and he or she has COVID-19, or we suspect they have COVID-19, and they're being tested. What do you do in that scenario? First, you tell the person, you stay home, you self-quarantine, you don't come to work. And second, then you interact with them and try to figure out if they can telework or if they need to be in a leave status. Obviously, if you can get value from them as an employee during this quarantine time period, you want to take advantage of that. But if not, then safety first.
Thanks, Steve. Beth, is notifying employees that someone has tested positive a requirement or a best practice? And if it's the former, what exactly requires it?
So I would say it's a requirement based on my reading of OSHA requirements, that it's important to notify. It's always important. It's always an obligation of employers to advise employees of unsafe conditions in the workplace. So it's a requirement under OSHA. There's also some record keeping requirements around positive cases of COVID-19 in the workplace, which I didn't touch upon, but something to be mindful from an OSHA standpoint too. What's required is to make employees aware that there has been a positive case in the workplace, and they may have been exposed to it. And so there's different ways that you can do that. You can ask employees going into a return to work scenario to keep a record of their interactions during the workday, and so that you can review that to determine who you may need to notify if there is a positive COVID-19 case that comes to your awareness. You also can make a decision based on your understanding of who interacts, in the workspace. If you have different floors, for example, You may let everyone know on the floor of the positive case that there's been a positive case. That's another way to do it. Communication, in terms of how you communicate, I'm a fan of verbal communication. I think it's more personal. I think it's also more appropriate given the medical nature of the information as opposed to a broad blast email. And of course, there's different state agencies have different reporting requirements as well. So you're going to want to consider what your obligations are under your state agency reporting requirements.
Great, Beth. I think this next one is going to be for you also. Can you put travel restrictions on your employees? And relatedly, for folks who have been out of state during this quarantine period while they've been away from the office, can you ask them to self-quarantine for some period of time before they come back into the workplace?
Okay, that's a great question. So in terms of travel restrictions, when it comes to work travel restrictions, you absolutely can control that. You can tell employees you do not want them to be traveling outside of a certain geographic area for business-related purposes. Something also to keep in mind is, as you all, I'm sure, are aware, certain states have quarantine obligations for residents entering into their state as well as returning to their state. So that definitely should be considered when employees are thinking about traveling outside of the state in terms of impact on business operations. If there's an obligation to quarantine either on the receiving end, destination end, or on the return side. In terms of personal travel, many states do have laws that prohibit employers from regulating an employee's legal activities outside of the workplace. So that's something you're going to want to be cautious about in terms of telling employees they cannot do something outside of the workplace. However, you can tell them they cannot come into your workplace if they have traveled outside of the state. So to answer the second part of the question, yes, if you are not feeling comfortable having employees who travel outside of the state come into your workplace, you can require them to self-quarantine for a period of 14 days after returning to the state before coming into the workplace.
I'm really glad to hear that, since that was a council policy for about 22 minutes. This is a two-part question, and I'm going to kind of throw it to either of you. We're getting some questions about offering clients kind of return to work guides, particularly medical questionnaires, whether we have a sample to be used, and whether we think that offering that to clients creates any legal liability on behalf of the brokers who are providing that.
No and yes.
I got it. You know what? I'd like to keep that there, unless, Beth, you have something to disagree with. That seems like a good lightning round answer.
Nothing more to add here, Steve and Scott.
Beth or Kate?
Yep, here's another quick one, hopefully. May you terminate an employee who refuses to comply with your safety protocols, such as wearing masks or not coming to work if they're showing symptoms?
Yes. That's a quick answer.
Great.
All right, this is, again, I'm going to toss it up. Do you have to pay employees who are waiting to be screened? The questioner says they recall Amazon winning a decision that says they don't have to pay while people stand in line at a warehouse because of the long screening lines.
The answer is, as a general rule, under the Portal FLSA Act, you don't have to pay for the screening if it's not an essential part of their job function.
Perfect.
All right, Steve, we'll throw this one to you. May you restrict employees returning to work if they take public transportation or taxis and the like to work?
No, you cannot. But usually the question I get is the reverse of that, is the employee who is worried about public transportation and coming to work. And so you want to dialogue with that person. You want to talk about and provide PPE, masks, gloves for transit back and forth. Think about alternative forms of transportation if possible. But you would not want to tell a person you can't come to work if you're taking public transportation. There's there are probably a number of specific local and state and federal laws that would be implicated there, and we'd want to think through that very hard before we implemented any rule like that.
All right, thank you. Beth, you get the last substantive question. Can an employer require PPE, such as wearing masks, for all employees in an office as a precautionary measure, even if that's not required by the CDC or a state or local government? And so to generalize it, can you go beyond the recommended safety protocols if you want to in imposing precautionary measures?
Yes, absolutely. In a private workplace, employers are able to control what happens within the workplace. Now, I say this with the caveat that if we have an employee who requires some type of accommodation around PPE, you would want to consider the accommodation. I mentioned the contact dermatitis, but there may be other things that come up. I've seen quite a few, claustrophobia, some different things like that. So you always want to consider accommodation requests, but absolutely, yes, you can govern your workplace the way you see fit as a private employer.
That's terrific. Beth and Steve, I personally thank you, and I'd like to turn it back to Ken. And Ken, there is one open question that I'm going to give to you, since you should always get the last word. Will we be sharing this recorded presentation, and will our members be able to share that recording with their clients?
So thank you, Scott and Beth and Kate and Steve. Thank you so much. This has been a very interesting and at times a little bit jarring conversation, but one that's required. Regarding sharing this with your clients, this will be posted on the CIAB COVID Resource Center website, including the deck. But we are not suggesting that you share this with your clients. You can share the information, but the webinar itself, we would suggest you not share. Is that a sufficient answer, Scott?
It is for me.
Okay. So with that, I thank all of you for your time today. I would once again focus you on the website, the COVID Resource Center, where we are updating live most of the information there, including the Back to Work series. Elizabeth McDade will be planning a number of other sessions in the next few weeks, and you'll hear more. We wish you to be safe and healthy and work hard as we all get back to work. Thank you.